on muscles. We have so much to talk about on muscles today. I'm so glad y'all are here. We did start our club seat activity just a few minutes ago, and so I got lucky and got Eileen all to myself. And so we're here talking. For those of you who are here on YouTube, I can see the chat. Hi, I can see that you guys are here. I don't know who's here, but I can see that you're here, and I love that you're here. And please do add your questions in the chat as well. We're going to move through, like I said, muscles today and addressing them when they're unhappy. Ironically, that's the question that Eileen brought. Well, what if this muscle's unhappy? What do I do? So, Eileen, do you want to ask your question again? Because I held her on a cliff note. I was like, hang on, let me get us live, and I will come right back and answer that question. You want to ask the question again so we're all in the same conversation?
I hope I can ask this succinctly. So I'm curious in specific about the coracobrachialis,
Mhm.
which is one of the shoulder flexors, correct? And so we were talking about if I wanted to pinpoint that particular muscle, I'd put it through its action to see, because I wanted to see how I could like single it out. I can't single it out. We all work together, we're yoked,
Let's
right? But
single them out. Right.
yeah, so it would be inflection, and I can feel an issue, and okay, it can refer from different places as we were talking about too, but is in the flexing process, like thinking about the fibers, like if I were to break down flexion into step one, step two, step three, like in the angle, I know in some places the muscles hand over like a baton, like when we're going out here. Is that the same in shoulder flexion?
Okay, so the question is, how do I ID a muscle? How do I ID a muscle if I have some sensation going on and things don't feel happy? Is that the question? Okay. So this is what I shared with Eileen, which I think is really valuable. So for all of us to be in the know. So I'm going to repeat, Eileen, what you already heard me share when we were backstage. Number one, if you're not a manual practitioner, don't start palpating and trying to ID muscles. You're tinkering in a lane that's not yours. You don't need to do that. Don't do that. Okay. Stay clean, stay in your lane, do you, and don't try to be anything other than what you're trained to do. So you don't need to palpate unless you can. I did learn to palpate muscles. I didn't share this with you, Eileen, when we were backstage, but I did learn how to palpate muscles. And still, there was information that wasn't 100% clear in the IDing of the muscles with my very skilled hands because the muscle was passive. The client was laying there. There was no engagement. There were no muscle spindle activities. So even when you're trained to manually, strip muscle fibers and find attachment points and all of that, which is amazing. I'm not throwing shade on us. It still doesn't give you all the information you need about the muscle, which is again why I'm here talking to both sides of our lane here, manual and movement practitioners alike. We're loaded with information. We're super smarty pants and we're missing a bunch of information on both sides of the lane. So that's why we're here to get all the information. So if you're not a manual practitioner, don't palpate and try to be a palpation practitioner because you're not, and don't do that. And you're not missing everything if you can't. So don't panic. Okay? So that's number one about palpation. Number two is we talked nervous system last month. Nervous system, teaching to the nervous system, working with the nervous system, addressing the nervous system. I just had a phone call, a lovely connected call today with a practitioner from another continent, which is super exciting. I love when I get to connect internationally. And she and I also had the same conversation about sensory nerves and the nervous system being able to accurately tell us where we are in space and what we're feeling in space. It's a mixed message. And every one of us has an example of that. And the example she and I came up with is I asked her, I'm asking all of you, have you ever been working with a client and moved their arm or leg, whether you were a manual or movement practitioner, and the client's response was, oh, I didn't know that's where it feels like it should be here and not over here. And the example that she gave was, yeah, or letting someone know you're not laying down straight. You're crooked. You need to move over here. And for Schatz method practitioners, we do lots of visual assessment and we offer that folks, move a quarter of an inch or an eighth of an inch, and that makes all the difference. And they're like, oh my gosh, I thought I was. Or now that I did move an eighth of an inch, I feel like I'm about to topple over. So we have all kinds of examples from people who are doing visual assessment, manual assessment, palpation skills, movement, alignment, whatever, we all have an example of the sensory nerves are not giving you real-time information all the time. So to say, this is where the sensation is, I must go here. Gina, you're not listening to me. This is the muscle because it's right here. I can point to it. Not relevant. Not 100% of the story. The answer is not there. We just walked through that, right? So we just want to like take a deep breath. If we start feeling like I'm looking, I can't find it. Maybe it's not there. Maybe it's something else that your sensory nervous system is giving you intel on. Just be open to that. Be an anatomy expert instead of being an anatomy and sister. I just made that up. Number three is we know the law of the body tells us pain in the body is referred from somewhere else 90% of the time. So even when you can put your finger on an actual muscle spindle and actually elicit discomfort there, there's only a 10% chance that that's where the problem lies. Even when you can get sensation from the actual spot, it doesn't mean it's coming from there. It means it's handling it there. It's not the same. Okay, so that's number one, two, three. And then number four is the way you ID a muscle when it's not happy is in its movement, not in its passivity or its referral patterns. So, what is the muscle supposed to do? This is where Eileen and I left off. So, I'm not going to give new intel, Eileen. Okay, so what is the muscle supposed to do? Primary action. Then immediately, other side of the lever, who's supposed to help him by allowing, not help like Synergists, but who's supposed to allow the main guy to do his job? They will both give you equal restriction, seemingly equal restriction on a lever. Either the guy's not contracting who's supposed to contract, or the guy's not allowing or lengthening who's supposed to allow and lengthen for the other guy to contract. You got to know muscles and movement to be able to get that. And that, again, is not what we're taught when we're doing manual therapy and the patient's passive, just laying there. They're active because they got their appointment, but the muscles themselves are not active. So there's only so much intel you can get on a muscle that's not moving because muscles are designed to move. They're not designed to be passive. They get breaks and they get deserved breaks, but they're meant to move. So to work with them, they must be doing a movement of sort or an engagement of sort if it's an intrinsic muscle. Okay, so first it's the main muscle, then it's the guy that's helping him, and then as you stated, Eileen, no muscle moves alone. No muscle moves alone. Not any muscle in the body moves alone. So I shared this, I think, last week on Tuesday training. I want us to go in and learn each muscle so that you have a real clear relationship with that muscle and his job, and then immediately expand your perspective to remember that he cannot do that by himself. Even if you just look at the lever system and its opposites, but its main action can't be done by himself. There's very few, I don't think there even is a muscle in the body, a phasic muscle. I don't think there is a phasic muscle in the body that does the number one job all by himself. I just don't even, I can't even think of one. I don't think there is one. If I'm wrong and somebody else knows that answer, please, like I'm all ears. I've chosen the body as my muse as well. I get to learn every single day. But just based on the way the body's built on a lever and reciprocal inhibition, they can't move by themselves and they're not wired that way. So to absolutely insist that in shoulder flexion, which is the joint action that you brought up, that it's only one muscle, it would be really hard to do that. Not impossible, but it would be hard to do that. And here's the bigger answer before I tell you how to figure out which one it is. Why do you want to know? Because if you just want to ID the muscle just to ID the muscle, that's cool. There's a lot of reverence in that. I have a ton of respect for people who want to do that up, and I'm one of them. And like, yes. And what I quickly learned working clinically is that I really needed to know why I wanted to know. What was the answer to that question going to provide me to be able to solve the problem that I was working on? If you can identify a muscle, great. But we just gave several examples of why IDing that muscle would render you not like you're not solvent in the solution then. Just because you can ID a muscle doesn't mean you can fix why it's unhappy. So I'd also ask, like, why does it matter in any instance, in yours with your shoulder example, Eileen, or in any one of us working clinically, why does it matter to ID the exact muscle? Sometimes you absolutely need to do that. And there's times in our clinical work as Schatz method practitioners where I'm like, no, no, you need to know what muscle it is. Here's why. Because that muscle in his prime action may have something specific that nobody else has, no other muscle has. And in the specificity of that, you'll be able to get to the solution quicker. Not that you'll be able to get to the muscle ID quicker. It's never about the muscle ID, it's about the solution you can render from identifying that muscle. And we're doing that in our muscle challenge right now inside our club, where I'm having you guys all ID a muscle and what does he do and what else does he do. And so we're rolling that out for the month of September while we're here in Muscle Land. So and it's not called Muscle Land. I just said that. It's muscles and movement. It's our focus for the month, both here on Tuesday training and in our Shots Method mastery track and in our club for anyone who wants to join us and workshop out some high level anatomy. That's what we're doing this month. So, and all the channels, all the stations, all the places, we're in muscles this month. You want to ID them and know what they do for a living so that you can then intercept when something goes wrong. That's where we all want to be. We don't, you're exciting me with this question, Eileen, because you're like, no, no, I actually do want to know. Not many of us actually want to know muscles. What we want to know is how to get them to not be unhappy anymore. And so, from that perspective, I would say learn what they do and how to ID if they're not doing it, and then you can solve it. But you can't solve the problem if you don't know what the problem is. He's unhappy is not a problem. He's unhappy could just be a message, which is something else I want to share with us today as we move through training. Eileen, does that help you? Did we actually get to your question and to the answer to said question?
We got to an answer of one of my questions.
Woo,
Correct. Thank you.
we did it. Okay. Okay, excellent. Fantastic. Okay, well, I want to give you guys some more information today too about muscles because again, that's our focus for the whole month and certainly for today. And pause for station identification for just a moment. I want to make sure you all hear it from me first. For those of you to mark your calendars for October 13th, 14th, and 15th. For those of you who come to our summits every year, our practitioner summits, we are having a fall iteration of the summit this year because we have so much to talk about between orthopedic work and high level skill that our normal annual summit is now twice this year. So I want to make sure you guys know it. We're doing one in fall, October 13th, 14th, and 15th. I am not going to share any other details with you right now because we're still putting our party together. But those of you who've been with us for previous summits, you know that they're great. And I know that a lot of you like to be there live. It's literally the most feedback I get. I can't be there live. Can I get a replay? And I know you're all working clinically, and I get it. It's during working hours, unless we do it in the middle of the night, which would be super weird. It has to be during clinic hours. So there's a good chance you won't be there live for all of it. But if I give you enough notice, you might be able to carve out some time. It's Eastern time, Eastern Daylight, Eastern Standard. I don't know. It's ET time, 11:30 to 2:30. So whatever that works out to be in your time zone, mark those times, 3 days straight, 11:30 to 2:30 Eastern, New York time, and come for as much as you can. And we will be rolling out the speaker list and the topic list, and I'm super excited. I say that I know every summit, but like, wow, I can't believe I get to share some time with these practitioners. Amazing. And then share them with you as well. So do please mark your calendar and come live. As always, there'll be tons of training and downloadables and workbooks and all kinds of goodies that come with it. All the speakers are like, yes, absolutely. Let's get more training and more training and more training. Also, I will let you know, as I mentioned a few weeks back in Tuesday training here, and our very real shakedown that's happening with AI. That's a good thing, by the way. It's shaken down the slack to let the cream rise to the top. That's where we are. We're the riser cream toppers. And all of the experts that I've been engaging with to connect and put this panel together have all said the same thing. They're like, yeah, yeah, yep, we have a new element that we get to navigate. It's not scary, it's not bad, but we get to be responsible and it's fast. It's fast. So we need to get on with it. Hence the double summit this year. We're moving on. We're not waiting until spring. So please do mark your calendars, join us. If you want all the details and you're not on our email list, make sure that we have your email and we will send you all the details so that you can get signed up and registered. And of course, if you are on the email list, you will be getting notices. It's summit time coming up. Okay, so let's move back through some muscles. I want to talk about when they're unhappy. That's what you guys want to talk about too. When a muscle's unhappy, what do I do? I totally get the question. We need a little bit more context to the question to be able to answer that though. So when we're addressing a muscle that's unhappy, here's where the framework I want you to come from. Muscles don't become unhappy spontaneously. Remember that. Why does that matter? Because you want to know what went on that caused it. If you can find the cause, you can find the solution. Otherwise, you're just navigating the unhappy, which is the symptom. They don't get unhappy spontaneously. If you know that, you'll get closer to the solution. Muscles don't become randomly unhappy. It's not random, it's not age specific, it's not just like their plot in life. That's actually untrue. I might have said this in a Tuesday training earlier, well, not earlier this month, in the last couple of weeks. And if I did, it's worth repeating. If I didn't, it's definitely worth saying. There is no science that will tell you that a muscle knows age. So to say like, oh well, you know what? Right? Like immediately pattern interrupt that framework because we've all been taught to believe that like aging is this terrible thing. And so we sometimes just say things and don't even realize that we're saying untruths. Like anatomically, it doesn't actually add up. So it's not random that a muscle gets unhappy. And it's not that something's wrong with them. And here's the comparison I'm going to give you. If a brand new baby who doesn't have language yet and can't hold itself up yet is crying, we wouldn't say, oh, gee, I have no idea. Boy, it must really have a problem. There must be something wrong with that baby. You'd never say that. You'd recognize that the baby's not difficult or stressful or stress inducing. The baby's crying because it's trying to communicate something. Muscles give sensation and symptoms because they're trying to communicate something. And the something isn't I'm old and cranky. That's not the message it's trying to convey. It's trying to convey something else. So for us, as we're, raising our standards of delivery here and our expert level awareness, we're not going to start blaming muscles and calling them out and think that that's muscle ID. It's not. When we blame a muscle for, that muscle's always tight, that muscle this, that muscle that, that's like gossip talk. And that all that reveals is actually what we don't know. When you start naming out a muscle and pointing out his unhappiness as if he needs to be judged about that, what you're really revealing is your own lack of knowledge and skill. And if that stings, no, I say that with love, it's just a wake-up call. Like we don't do that. If you know better, you do better. And that's like equivalent of telling somebody else that the baby crying in the other room really has an attitude problem. Like you just would never do that. You'd go address it and find out what's causing the crying. The crying is not the problem. It's the message that the baby's trying to get across. Hunger, discomfort, wet diaper, whatever. Same thing with the muscle. What message is it trying to get across to you? Either that it can't do its job, the guy that he's relying on to allow him to do his job won't help, or he's now doing double work for somebody else who isn't showing up to the party, which is more often likely. That's usually what it is. It's usually that a muscle that's unhappy is bearing the load for somebody else who's not doing his job, and yet we're going to blame the muscle that's symptomatic. The only guy that's showing up for the job, like it doesn't make sense. When we start talking like that, we're actually revealing that we actually don't know muscles and movement and function. So stop saying that and pause and get clearer about what the question is. That's my appeal to all of you today. All right, and I'm going to give you a real-time example. So last week, Anna was here live and we were talking about gait, and I asked, what's one of the primary joint actions that happens in gait? And she named out hyperextension of the hip. You guys might remember that. If not, go back. It's a great discovery. One of my favorite ways to learn muscles is like when he's doing what? What does that look like visually? Hyperextension of the hip is when the leg's behind. but the leg can be behind and the hip's not extended either because we can do that and like break the law on what that joint action should be. And that's what you want to look for with your visual assessments. Is the joint action actually happening? But we're not on joint action right now. We're on muscles. In order to know muscles, you got to know your joint actions. They're literally yoked topics. Okay, so assuming that we're on clean joint action, meaning it's actually happening the way it should, in hip action is happening in the ball and socket joint for real, and the muscles who are supposed to do it are. We laid out last week that hyperextension of the hip prime action. You want to do it, Eileen? You want to be hot seated? Prime prime muscle for hyperextension of the hip. Main guy, big
Glutes.
ones.
Sorry.
Which glute?
Glute max. Sorry.
Glute max, yes. So when we say glutes, I've said this before, there's six possibles that we're talking about, four of which do nothing like the previous two. So we don't want to just, I mean, absolutely say I say glutes all the time. They're my buddies. Everybody that I love gets a nickname. My dog had like 36 nicknames. Everybody that I love gets a nickname. I shorten their name. I call them all kinds of things. I usually have to ask for permission. I think Anna would be okay. Well, I don't know. I should wait till she's here. But Anna has a nickname. She's like, yes, you're allowed to call me that, which is great. Muscles have nicknames for me. Totally get it. Glutes, babes, glutes, 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 glutes. And we still want to know what that means. There's six of them, and four do nothing like the other two. Big, huge difference, especially as you're trying to ID, as you were saying earlier, Eileen, what's actually going on here and where do I intercept as a provider, as a practitioner? Okay, so glute max is the main guy who does hyperextension of the hip. And who helps him, Eileen? Who helps glute max do hyperextension of the hip?
Well, that's from the opposite side.
Yep, he allows it. So as allows, who helps? Who helps glute max do the job? Synergists. So synergists are helper bees. Antagonists are the allowers on the other side of the lever. So who's on the same side of the lever who helps glute max do his duty?
I know this and I'm drawing a blank, which is angering me.
I know. I'm on camera. I'm being recorded. This is painful. It's hamstrings. Yep, so hamstring, you knew it. So hamstrings help glute max do hyperextension of the hip. Help, meaning, side job. They're also lifting boxes out of the moving truck kind of thing. Allow is on the other side, meaning I'm not going to get in your way. In fact, I'm going to move all the traffic out of the road so that then you can go drive down the road and do the action. Says the opposite side of the lever, known as the antagonist, and in this case, it would be psoas. And also rec fem, rectus femoris, again with the nicknames, it's super cool. And rec fem has, another job that he does as well. Now, as we're starting to stack roles, this muscle does this main job, and then this muscle or group of muscles helps him. But then if I look just at that helper group of muscles, they actually full-time do this other thing, but then they also help do a third thing. Same thing with rectus femoris as an example, right? Rectus femoris is a quadricep muscle. You would know that as a knee muscle, right? One that does extension of the knee. However, he's biaxial, so he has this other role that he does also at the hips, and he happens to help. So as why does this matter? Because you could have discomfort, that referral pain we talked about at the beginning, into your thigh, when actually what you have is a hip flexion, main job of psoas, or hyperextension of the hip, main job of glute max. And you got to just be able to sort that out in clinical, in a clinical setting. Hey, Debbie, glad you're here. Hello. All right, so in Gait, we have now ID'd substantially. The main guy who does hyperextension of the hip is glute max. The main support staff for that action is hamstrings. Yep, exactly. The guy who allows, like equal lever, psoas, and then the guy who helps him do that is rec fem and iliacus. Okay, cool. But if you guys were here last week and you heard this conversation that I had with Anna, she also said QL. QL does hyperextension of the hip, and it does not do hyperextension of the hip. So, in the learning, and I'll tell you why she said it in a second and why it matters in a muscle being unhappy, what do I do about it? There's several steps that you need to follow in order, and when you follow them in order, you will have clarity. If you don't follow them in order, you will create confusion, and then you'll come to me with a question, and all I'll do is ask you to get clearer because then you have the answer. And then you're empowered to come up with the answer on your own the next time. Okay, so here's the order. You do need to learn muscles. You need to know what they do. Whether you're manual or movement practitioner, you need to know muscles and what they do. What you do next is, up for conversation, but you need to know what they do. And one of the easiest ways to recognize an action that a muscle does, when I say idea muscle and what it does, that is implied the action. And the action is always contraction. I said that a couple years ago and everybody was like, ding, I can remember that. The action's contraction. The action isn't stretch. The action is contraction. So if I'm recognizing and IDing a muscle and what it does, what I'm saying is I'm recognizing a muscle when it contracts. When it contracts, it moves bones. This is right up. This is like layering now our 8 principles, right? So, and we did 8 principles in May, I think, of this year, and we're going to do it again in January. So if you guys are still looking for that content, it's coming. When a muscle contracts, it pulls on a bone and an adjacent bone, and then the joint moves. The movement happens at a joint. It doesn't happen in the, shaft of a long bone. Why does that matter? It matters because as you're IDing muscles and learning what they do and trying to picture them in your head, a muscle is always you can always identify a muscle's action based on the joint that it crosses. It has to cross the joint that it's moving because it pulls on the muscle that it's attached to and its adjacent, excuse me, on the bone that it's attached to and its adjacent bone. That's how movement happens. That's straight up architecture. There's no debate about that. That's an ism. We don't have to ponder that. It just is. So if you're looking at a muscle and you see that it crosses over a joint, it moves that joint. Easy. So now we're back to gait and hyperextension of the hip, which is down in the ball and socket joint of the pelvis. Does the QL cross that joint? No, it does not. So to call out QL as a muscle that does hyperextension of the hip is incorrect. Has to be because it doesn't cross that joint. How could it move the joint unless it crosses it? It can't. That makes I love when things get like solid because the body is so like it's like a moving piece of art, right? And so when I can get like really clear on some things, it just helps sort through a lot of data real quick, right? I don't have to ponder anymore and strategically think about things that are absolutes. A muscle moves a joint when it crosses that joint. QL does not cross the hip joint, therefore it cannot move that joint. Period. The end. There's no debating, there's no strategic thinking, there's no pondering. I love that kind of freedom because then I can move on to what's next. So it's true that QL does come up in conversation around gait. It is incorrect to think that it's because of the action that it takes on that hip joint, because it doesn't take an action on the hip joint. That right there, knowing that distinction in muscle identification and what it does and what it's absolutely not even able to do because of its location, will give you so much clarity on solving the problem, which is the most common question I get. I have a muscle that's doing this. I have a muscle that feels like that. What do I do? And I will always bring you back to what's the main job of that muscle. If you can ID and you can, the main job of that muscle and where he sits in the lever and in reciprocal inhibition, you'll have your answer. But when we jump too far to this muscle's unhappy, this muscle's unhappy, something's wrong with the muscle, first of all, that's not true. We already said that. There's nothing wrong with the baby when it cries. It's just communicating. There's nothing wrong with that muscle. But the fact that the muscle is unhappy is where our work is. And it's also where you guys want to go naturally. Like, I get it. That's where you want to solve it. How do you solve it? Not by memorizing a whole bunch of possibilities. It's endless possibilities when it comes to the body and how it can get the job done, right? Endless possibilities. There's no matrix for that. But the matrix is, what does it do? What's its primary action? And who's allowing him to make that action happen? If you can get super clear on that, there's your matrix. If it's if a main if muscle's got a main job and that main job is not being done or not being done without pain, that's the problem. That's the problem. To go back to the muscle that's supposed to do the job, get him to do it. Well, how do I do that? Well, there's your skill. Like that, I could teach you that in a workshop. I'm sure you have workshops already. That's the skill part. But to ID it first is the critical place. Just pause and get really clear on what the muscle is and what it can do. So we've said QL does not do hyperextension of the hip. And yet we have a ton of clients who have discomfort after walking. They have hip pain after walking, low back pain after walking, SI joint pain after walking. The walking, the walking, the walking. The walking's the problem. Okay, so the walking's the problem. Walking's not the problem. Walking's not the problem. We're literally designed to move. All of that prelude that we talked about at the beginning of training today is that muscles are meant to move. So there's only limited information you can get from them by palpating them when they're passive. You get a ton of information about their ability to do their job when they're actually asked to do the job. Like, you don't get a whole lot of intel from someone in the interview process about whether they're qualified. You get some intel about whether they're qualified, but you have to actually watch them show up to work to see if they actually are good at what they said they're good at. Same with muscles. They have to show up for work. They have to be asked to contract to see if they're actually going to do that and do that well. Okay. So the walking's never the problem. And I just had a practitioner tell one of my patients that the cause for their low back discomfort that nagged for a few days was because they walked too much. Makes me want to call and have a cup of coffee with that practitioner and be like, you can't tell people that. You can't make them afraid to move because that's literally not the problem. And it's again, it's just revealing that you just don't really know. So you're going to blame the movement or the muscle on the problem instead of solve what's the body trying to tell me if walking was doable, but then it was uncomfortable afterward. That's where you want to be in your brain about it, not tell the client that they walked too much. Okay, so when you know the function about what the muscle's supposed to do, um, and have a context for it, right? So like glute max does hyperextension of the hip. When does that happen? It happens in walking. When else does it happen? When else does it happen? When else does it happen? There's your function, right? So the muscle, his job, his joint action, and then in what movement pattern, what function would that show up in? You want to identify that. You want to know the muscles and their group that they belong to for that function. Because again, no muscle moves by itself. It's impossible. It's not wired that way. And this is valuable path work for both manual and movement practitioners. If I am a manual practitioner and someone tells me that their back hurt after they went on a long walk after dinner one night and they had comfortable shoes on and they were really watching and all the other things I asked them to do, they were doing, but then they have no way to explain why their back hurt. I still need to know what muscles were on that walk with that person, what muscles were needed in that function. So far in Gait, we talked about one joint action. There's several in Gait. There's several steps of Gait that all have a joint action and a whole host of muscles in an orchestra. So you need to know that even as a manual practitioner. And movement practitioners tend to know the movement, but not be able to ID which muscles actually on boards. There's some memorization on what muscles do what joint action. All of us need to know that. And then you get to assess, is that group of muscles actually doing that job? Meaning that joint action. And then in tandem with other joint actions is the function part. Trying to assess gait or change gait while you're in it's really tough. Got to break it down one joint action at a time and all the muscles of reciprocal inhibition in each of those joint actions. That's why we had Gait Masterclass. It's still in our club. For those of you who are club members, you still have access to that. I would go look at it and look at it again and look at it again from each muscle and each lever, and then just try to identify just that lever and the orchestra of muscles that are supposed to be doing that joint action, and then do the same thing, the same thing to assess and definitely to assess and make changes to function while you're in it. I wouldn't, I highly recommend you not do that, by the way. The brain can't even keep up with you because it's running on a neuroplastic pattern. You won't create change. You just won't. All right, so that takes us back to in gait on the one joint action, hyperextension of the hip. Why was QL brought to the table last week as if he was doing hyperextension of the hip, which we've already said there's no possible way he can. It's when things go wrong. And when I say wrong, I mean like not optimal function, not optimal design. Nothing's wrong, right? Like nothing's wrong. The body's not wrong. In fact, if I'm meant to be using glute max and hamstrings, opposite psoas and rec fem to do hyperextension of the hip so that I can walk, and one of those four only is not able, well, hamstrings is three, but one of those four identifiable parts of the lever is not able to show up for the job, nothing's wrong if the body got me to walk anyway. In fact, that's quite lovely. Like the body will do whatever you ask it to do, even at the risk of discomfort or harm. How lovely. Like how completely devoted to anything I say that I want, right? So again, we don't want to be blaming muscles for when they show up uncomfortable. They're telling you, I did something for you for 2.2 miles on that walk, and I didn't complain once so that you could enjoy the walk. But now I'd like you to address some things because I don't want to do that again on tomorrow's walk. That's not mean. That's lovely. We should all treat each other like that in relationships, right? So our role then is to find out, well, why is the low back sore after walking? Why would that be? Why would that be? Start at the beginning. What muscles are supposed to be doing the job in walking? And in this case, it's hyperextension of the hip. And are they? If the answer is no, that's why you have any discomfort anywhere else in the body. Not because the other place in the body, something in the low back, oh, his low back's always tight. Really bad answer, by the way. Like almost eye rollable. And I mean that with love and respect, but it's not a good answer, guys. His low back's always tight is not an answer. His low back being tight, really where I should focus. Not if 90% of the pain in the body is referred from somewhere else. I'm only going to get a 10% chance of winning that game. What else do I really need to know? I really need to know what joint action was being called on in that activity and what muscles do that joint action and were they? You can't go back in time and find out what was going on in that gait pattern in the moment, but you can certainly check that same joint action today. Okay, client, go ahead and step your leg back, AKA hyperextend your hip. And then you, as the clinician, go and check the first four on the lever, especially the agonists and antagonists, and then check their helpers. And if they've all shown up for the party, okay, then keep moving on. Maybe you're now into synergists. Chances are, though, when you check the lever and the muscles of reciprocal inhibition, the orchestra, we call it, chances are when you go to check all of those players, someone's got a sour note. And that's why the song doesn't sound pretty. That's why the backache comes after the walk. 99% of the time, there will be your answer. So when you guys ask me, Gina, I have a client and this muscle right here is really sore. And every time they move their leg, it's sore. Every time they lift their arm, it hurts. What do I do? This is my answer. What's the joint action? Who's supposed to do it? I just told you when they lift their arm. Okay, but what were they using their arm for? What were they using their back for that their back hurt after a walk? Why were they using their back to walk? They shouldn't be. It's not the joint action. You break down the joint action, break down the function by joint actions, and then assign the muscles that do that job. I literally just gave you the king to the kingdom, guys. Everything else after this is just memorization, honestly. All right, we have a couple minutes left. What questions do you have now? I know no one's going to ask me. I have a client with X. What do I do? No one's going to ask me that, but and you can. You absolutely can. If you're like, but I actually heard you and I still don't know how to answer that question. I'll walk you through how to get there. That's fine. But I will gladly answer questions right now. Anybody here in the live have a question? You're welcome to pop that into the chat. I'll answer questions from you. Eileen, you got another question?
I have a random question in regards to the pelvic floor.
Okay.
So I guess my question is, do we consider that to be a joint where the pelvic
Different,
floor muscles?
great question. Different class of muscles. So everything we talked about today with joint actions and reciprocal inhibition and levers, those are all phasic muscles.
Hmm.
So when you start looking at intrinsic muscles, we don't think of them as a joint, but there is a lever like um there is a lever. What's the word I'm looking for? Analogy is the word that's coming up, but I don't know if that's actually accurate. But there is a consideration of
Hmm.
lever when you're working with intrinsic muscles, although it's not a phasic lever. So a phasic lever is like the teeter-totter, right? This one
Yeah.
goes up, that one goes down, and when that one goes down, that one has to go up, and they cannot go independently from each other. That's a lever. That's all phasic. When you're working with intrinsic muscles, different group of muscles, they don't have the same kind of lever because they don't do joint actions like that.
Mm.
But there is a consideration on when this guy does this, that guy has to do that. Not the same exact analogy, but it's the best way to soothe your mirror neurons to share it like that. There's a lever consideration, but there's no joint action because they don't move joints. That's not their job.
Right.
Everything that moves a lever has the job of moving a lever, meaning AKA creating a joint action. That's phasic.
There. Super. Thanks.
Got it? Okay. Super thoughtful question. I love it. Any other questions, guys? Anybody in the chat? All right. This is a slightly different conversation, but I have brought up AI a few times, and I want to just share with you a really interesting discovery that I had in the last few weeks that's relative to you guys as you're looking for your next training. And ideally, you would come to the Practitioner Summit in October and meet real live people with real live history and real live training, and you wouldn't be duped. However, in my looking through the internet for contact information and emails and things to reach out to some people who I'm just meeting for the first time, the phones listen, the algorithm catches you, everything that's sticky. As soon as you stare at something for more than 3 seconds, poof, the next thing you know, you get a whole string of ads that look like the same thing you just looked at. Even though you weren't really looking, you actually just, I don't know if this has happened to you guys. I've been brushing my teeth before and my hands were wet and I just didn't want to I just didn't want to touch my phone. And so the whole ad like played. And then the next thing you know, I'm like, I wasn't really watching, but okay. And so then it goes away because you just click off of it the next time. So we all know that we're being watched. Okay, cool. And sometimes that actually helps me. It's like, oh my God, I just found these other three people that I didn't know before. It's like so great. Thank you, algorithm. So every once in a while, it works in your favor. Well, one of the experiences that I just had was um, an ad came up and was playing, and it was saying everything I wanted to hear. I'm like, oh my God, this sounds like exactly like how I train. Who is this person? I totally want to know this person. Like, we should be collaborating. This is amazing. And I went and looked at the phone, and it was a person talking. And I don't know, ever have that feeling where like their voice doesn't really match their face kind of thing? And you're like, I wonder if they've got like laryngitis or like something, little something going on. It was one of those which really got me to stare at this face. And I don't know if you guys know this right now, but AI is even Hollywood's being threatened by AI right now because you can absolutely make very real looking people move and talk and their lips don't miss and they don't have 6 fingers on one hand and all that weird shit's gone now. And so they're talking about licensing the voices of actors that we know to put on not real actors and then make movies out of them. This is happening. This is actually happening in real time. We think it doesn't apply to us, except that I was watching this ad and then clicked on all the links, and I know how to find someone's contact information. Believe you me, I've had I know how to get a hold of someone. There was not one live person I could reach and not one real contact bit of information other than a website. There was no phone number, no email, even like everything that I clicked on did not have a way to connect with a human. And that got me thinking about what I'm learning on YouTube and AI and just what we're facing right now. Remember, this video that I saw was so compelling that it caught my ear like I wanted to train and collaborate with this person. It's not a person. Here's what it actually is. It's somebody who is interweb smart, who fed feelers out into the internet, gathered a whole bunch of data, had AI make it into a course, which probably happened in the span of 3 or 4 hours, loaded a website, which probably took 20 minutes, and put all the connective parts together, if there was a human involved, might have taken a few hours of time. And now that person is now selling other people's content that it has just extracted and compiled into a course. And you might think, wow, that's super innovative. Awesome job. Sure, super innovative, awesome job. My question for you guys is where are you going to get your questions answered? And how do you know that the information is valid? Can humans make mistakes? Absolutely. I make mistakes every single day of my life. But I also know enough to correct them, and I can go back and explain it, and I can also say it in several different ways so that you can understand it. Here's my plea. If you're looking for quick, cheap, and easy, please consider another industry because right now it's going to be very difficult for you to thrive for a long period of time sustainably if you're taking shortcuts right now, because the shortcuts can happen even for your clients. They're seeing the same videos, but they're just directed at how do I get rid of my low back pain and save money and not have to see the clinician. They're seeing the same videos and they're buying them for 19.99 instead of coming to see you. And then they're getting hurt, and 6 months later, getting back on your calendar, and it makes it harder for you and them. So you could just wait it out if you want to. I had an email exchange with a practitioner this week who said, I think I just want my client to go away and then figure out that she needs me and she can come back later. No, no, you don't. It's harder for both of you if that happens. And also, if I knew that someone was going to let me walk into fire without telling me that I was going to get burned, that there was a chance of me getting burned to do that, and then they just waited for me with some aloe at the other side, I wouldn't trust them at all. That is not what you want to do. What you want to do is be the stronger voice with more clarity at the forefront because we're all being lured in right now by robots. It's one of the things that's happening in YouTube right now. YouTube has, we obviously are watching this on YouTube if you're here live and not in the club seats. And our channel's not monetized. I'm not getting paid by YouTube, nothing like that. But they do clock your hours to see how many videos are watched and, if people, and we watch our analytics to see like, am I grabbing people's attention? Am I offering value? And if I am, I would love to hear from you and not from YouTube. Tell me that there's value here for you. But one of the things that happened in the last several months is all of those tickers went to zero. And we had to figure out why that was. The reason is because there were so many robot channels. They call it faceless, nameless channels that a human is asking AI, a robot, to make a channel with robot information, and their traffic is huge, and YouTube was paying them. YouTube was paying a nobody and losing a ton of money. And so they took us all down to zero and was like, yeah, we're not paying anybody until we can verify that there's a human there. So it's happening. Even YouTube's getting duped by who's real and who's not. So you may also be following someone who's not a someone. And so I'm just asking, better to be in a training with someone who slurs or trips on their words, that would be me, or can make a mistake and come back later and clarify it. And if there was anything that you were going to do that was going to be delayed, let it just be the realness of humans. But don't try to go quick and cheap and fast right now. Um, and keep your eyes and ears open. So, just a little PSA about what's going on out there. Make sure you're learning from someone who actually has clinical experience because there's a whole different learning curve on what to do with this book information and how to apply it to every single person that has literally a different thumbprint. Every single person on the planet, including identical twins, has a different thumbprint. So if we're going to think that there's a cookie cutter way to address all of them, again, I urge you to make it easier on yourself and pick another path because that's just not how it works. You need to be able to learn from someone with clinical skill because that's a whole different, you take your book knowledge and then you apply it. And every time you apply it, it's something slightly different. You want to learn from somebody who does that so that you can get there quicker, right? If you're going to spend your time and money learning. And with that, I can't believe it's been an hour. Can't believe it's been an hour. If there was value here for you, I would love to hear that from you. It's definitely my intention. Please do let me know if it resonated and if there's enough value that you want to share it, I would be delighted. Thank you so much for that. Thank you for being here, Eileen. Thanks for hot seating over and over and over and over and over for the benefit for all of us to learn. And I will look forward to seeing everybody here, same time, same channel next week. And in the meantime, continue to do really great work in the world. And I'll see you guys next week. Bye for now.